Okay, hello everyone. So now we will be discussing about the postnatal complications. So under this postnatal complication, there are five main topics I will be discussing in this section. That is, first one is PPH, that is postpartum hemorrhage. The second one is perfural sepsis. Okay. The third one is breast encroachment, and the fourth one is postpartum blues, and the next one is postpartum depression. So this five condition we will be discussing in this section. So first one is postpartum hemorrhage, that is PPH. So what is PPH? PPH means it is postpartum hemorrhage. After the delivery, the excessive bleeding is known as postpartum hemorrhage. Okay, so in the definition we can tell postpartum hemorrhage is the excessive bleeding after the delivery. Okay, so that is diagnosed as a postpartum hemorrhage. So how you will be identified that, because vaginal bleeding is a normal after the delivery. So how you will be identified means, in the vaginal delivery 500 ml is the normal, in the cesarean section 1000 is the normal. So when it is going more than this in the condition, okay, so that condition is diagnosed as a PPH. Okay, that is diagnosed as a PPH. Okay, then types, there are two types of PPH is there, primary PPH and secondary PPH. So primary PPH, when you are talking, it will occur within 24 hours of delivery after the childbirth. Okay, so within 24 hours, when the woman is diagnosed with the heavy bleeding, okay, that is more than the 500 ml in the vaginal delivery and more than the 1000 ml in the cesarean section, that is known as primary PPH. Then secondary PPH. What is secondary PPH means? The bleeding is diagnosed more than 500 and more than 1000 ml after the 24 hours, okay, after the 24 hours of delivery up to 6th week of postpartum. Okay, so in the postnatal time till 6th weeks, if the mother is after 24 hours till 6 weeks, if it is diagnosed with heavy bleeding, that is, or excessive bleeding, that is known as secondary PPH. Okay, then what are the causes of PPH? Mainly easy to understand, there is 4T we will tell. Okay, 4T is there. So what are the 4T refers to means tone, okay, that is uterine tone. Okay, so uterus does not contract properly, so that may leads to the PPH. Then tissue, the second T refers to tissue, placental pieces, okay, retained placenta conditions and all, we can take this PPH conditions. Okay, so example, retained placenta. Then trauma, okay, so trauma means cervical tear, vaginal tear or uterine rupture. Okay, so when trauma has happened in the uterus or in the cervix or in the vagina, that may leads to the heavy bleeding. So that is the third T. Okay, that is trauma. Then the fourth one is refers to thrombin. Okay, thrombin means blood clotting problems. Okay, when the woman is having the clotting problems, that may leads to the heavy bleeding. Okay, so this is the four main causes of PPH. Understood? PPH means it is a excessive bleeding after delivery. It is, if it is normal delivery, it is more than 500 ml. If it is gone, the bleeding is there, that is known as what is that, PPH. If it is cesarean section, if the more than 1000 ml is there, that is known as PPH. Okay, there are four etiology, four T, it refers to etiology, that is tissue, tone, trauma and thrombin. Okay, the next one is risk factor. What are the risk factor? It may leads to the PPH means multiple pregnancy. Okay, when the woman is having multiple pregnancy, example twin pregnancy, then it may leads to the PPH conditions. And polyhydramnios, excessive amniotic fluid is there, that may leads to the condition of PPH. Then prolonged labor, when the mother is having prolonged labor, that may leads to the PPH conditions. And large baby, because large baby, it may leads to the episiotomy. So episiotomy tear, okay, in the tear can be extended, the episiotomy wound it may happen, so that may leads to the PPH condition. And previously the woman is diagnosed with the PPH, that also may happen in the risk factor. Okay, then cesarean delivery, it's a mother is undergone for cesarean delivery, that may leads to the PPH. Okay, so excessive bleeding will be there, and mother who have anemia conditions, okay, so that also may leads to the PPH condition. So these are the some of the risk factors. Then signs and symptoms, how to identify this mother is having bleeding is the one of the signs and symptoms. Okay, heavy bleeding is the one of the things. Heavy vaginal bleeding will be there along with the blood clots. Okay, and the mother look like a mother may leads to shock. So what are the signs of shock? So accordingly in the signs and symptoms will be there, like a weakness will be there, and pale skin, and fast what is that, pulse rate will be there, the pulse rate will be increasing, and low BP will be there. Okay, blood pressure will be decreased, and dizziness, the mother will have the dizziness, and also the mother will have the cold skin. Okay, the skin will become cold, and restlessness. Okay, so these are the signs of shock. So mother will have the excessive vaginal bleeding with the blood clot, and the sign of shock will be present. Okay, the next one is the diagnosis. The diagnosis made by the observation. Okay, the bleeding will be there, no? So amount of blood loss we should be identified, that input output chart after delivery you have to maintain the input output chart. So through that chart we will be identifying that the mother is having the excessive bleeding. So amount of blood loss and vital signs, because increased pulse rate, decreased blood pressure is there, so that can be identify the causes, the conditions. The next one is uterine contraction. Okay, so uterine contraction you have to check it, and placental completeness, you have to check the placental completeness, because one of the etiology is retained placenta condition. Okay, when the placenta is not completely delivered, that may leads to the PPH conditions. Okay, then blood investigation can be done. So these are the diagnostic procedure should be done. Okay, then management. So how to treat this condition, PPH, how to treat the condition? Call for help. Any emergency you have to call for the help. Okay, so immediately check, immediately you can look for the help by calling the obstetricians. Okay, if it is emergency condition in the postnatal time. Then assess the mother, check for the airway, breathing, circulation, because the mother may have the shock, it may leads to the unconsciousness. So you have to check for the mother airway, breathing, circulation. So that is a second assessment you can do. Immediate management. Okay, under the immediate management I'm telling, first one for call for help, second one for the assess the mother conditions. The next one is massage the uterus. Okay, you can start massage the uterus, so it helps to contract the uterus. Okay, contraction can happen. Then IV fluid should be started to prevent the electrolyte imbalance and the dehydrations. Okay, and replace the blood loss also. It will replace the blood loss also. Then oxygen administration, if the mother is not having stable, you can provide the oxygen administration. The next one is medicines. What are the medicines will be administered immediately? Means oxytocin is the primary drug, because oxytocin, even once the uh, placenta is delivered, you can administrate the oxytocin, that will make the contraction, then that will minimize the bleeding. Okay, so oxytocin is the first line drug you can administrate. The other drug include the misoprostol. Okay, misoprostol also you can administrate to the mother who's having the PPH. Okay, then blood transfusion, if it is heavy blood loss is there, the mother is required blood transfusion, immediately you can start with the blood transfusions. Okay, the next one is surgery. So surgical management, if it is needed, you can perform with a balloon tamponated or the B-lanced suture. Okay, B-lanced suture means the suture can be done in the cervical area, or hysterectomy can be performed if it is a rupture is occur in the uterus, complete rupture is there, then you can perform the hysterectomy, that is removal of uterus can be done. Okay, so this is the surgical things, if it is needed only you can perform in the management. Okay, The next one is shock complications. So when you're talking about complication of PPH, first one is shock. Okay, the mother will have the shock and severe anemia due to the blood loss. The mother may develop with a severe anemia condition, and infection will be there in the mother. That is perfural infection we will tell, or perfural sepsis. We are going to discuss second condition. Okay, so that is a perfural sepsis may happen, and kidney failure can happen in the mother who have the PPH as a complication. Okay, the next one is maternal death. Sometimes, very rarely, maternal death also can happen in the mother. Okay, so this is the complications. And prevention, when you're talking about prevention, in the antenatal, prevention is from the antenatal care. Okay, so from the antenatal time only proper care should be provided. That is, antenatal care can be provided to the mother with a antenatal checkup. Okay, then treat anemia. If the mother is diagnosed with anemia in the antenatal, treat the condition in the antenatal before labor itself. Okay, then skilled delivery care. Okay, so the delivery care is very important, intrapartum care is very important, that should be provided. And active management of third stage labor is very, very important. So active management of third stage labor, you can be performed immediately. Once the mother is delivered completely, you can provide the care, then you can shift the mother to the postnatal ward. Then next one is early identification of risk factors. Okay, so what are the risk factor or etiology we discussed? Early identification is very important. Okay, so accordingly we can treat the things. Hope understood this PPH, right? PPH is the excessive bleeding after the delivery. Okay, so that is very important condition, very, very important condition of this thing. Okay, the management, nursing management, what you will do in this assessment, assess the mother condition, that is monitor the BP, pulse rate and respiration. Okay, then observe the bleeding. Okay, so observe the bleeding from the vagina, then assess the uterus. Okay, so you have to assess the uterus. And also nursing care include IV infusion with IV that is IV infusion with blood transfusion if it is blood transfusion is required, and give medications like misoprostol or oxytocins, and provide oxygen if it is needed, and record the intake output chart. That is very important as a nursing management. And maintain the cleanliness to prevent the infection, as well as emotional support is very important to the mother. Okay, and also you can provide the health education regarding the danger sign of PPH. Okay, because it may leads to renal failure also, so you can advise the mother about the health education and the importance of follow-up care. Okay, so that is also very important. So this all about the PPH. The second one is perfural sepsis. So what is perfural sepsis? Perfural sepsis means it is an infection. Okay, so a sepsis means refers to infection. Okay, perfural sepsis or infection is in the genital tract occurring during pregnancy or during labor within 42 hours of postpartum period. Okay, that is after delivery. It's known as perfural sepsis. Okay, that is known as perfural sepsis. It may be leads to by the microorganisms. Okay, it may be the leads by the pathogenic microorganism. There are two types of perfural sepsis. One is perfural septicemia and another one is perfural pyrexia. Okay, pyremia. Okay, so perfural septicemia means infection spread through the blood streams. Okay, bloodstream, through the blood streams the infection is spread to the mother. Okay, perfural pyremia means in septicemia with multiple metastatics. Okay, multiple metastatics, that is the two types. Okay, then what are the causes of this perfural sepsis? Ascending infections. Okay, so infection from the vagina or in the cervix. Okay, so through the cervical and through the vagina the infection, okay, can occur, that is microorganism can enter and it may leads to the septicemia. Okay, the next one is prolonged labor. Okay, so when the mother is exposure long time. Okay, so that is prolonged labor. Last section we discussed what is prolonged labor means, taking long time. Okay, so especially in the second stage. So during prolonged labor time there is a chance of developing the perfural sepsis. And repeated vaginal examination, when the mother is undergone for repeatedly vaginal examination during labor, that may leads to the infections. Okay, then next one is retained product of placental or conception. Okay, so any part of, no, labor means everything that is conceptional product should come out through the vagina from the uterus. So when it is retained in any part of membranes or any part of placenta, that may leads to the sepsis. Okay, the next one is poor perineal hygiene. Okay, so perineal care is very important. When it is not performed properly, that may also leads to the perfural sepsis. And instrumental delivery means, like example, forceps delivery. Okay, when the mother is undergone for forceps delivery, that may leads to the perfural sepsis. Okay, I think we discussed in the complication of forceps delivery. The next one is cesarean section, LSCS also may leads to the what is that, perfural sepsis. Then mother is having anemia, poor nutrition, low immunity power, that all things may leads to the perfural sepsis. Okay, so these are the causes. And what are the risk factors? Risk factors include prolonged rupture of membranes. Okay, so rupture of membranes occur in long time. Okay, so that is a prolonged rupture of membranes, and prolonged labor, and multiple vaginal examination. Okay, many time, frequently the vaginal examination is done, and a retained placenta or the conceptional product, and instrumental delivery, cesarean section, anemia, malnutrition, poor personal hygiene or poor perineal hygiene. Okay, so these are the risk factors. Then signs and symptoms. When you are talking about signs and symptoms, and the general symptoms may present with a fever, because infection may leads to the high temperature, elevate the temperature in the body, so that will be high grade fever will be there. Then chills with rigors and malaise, weakness and loss of appetite, headache. Okay, rapid pulse will be there. Okay, that is a thing. And local symptoms include lower abdominal pain. The mother may complain that she have the lower abdominal pain, and foul smiling lochia. Okay, the lochia means after the delivery the discharge is known as lochia, so it may smell. Okay, so the smell will be, the odor will become very smelly. Okay, so that will be there. And tender uterus will be there. When you are performing the examination, abdominal examination, to find out the invulsion, there may be the tender uterus will be there, and subinvulsion will be present. Okay, more than the absence of invulsion, subinvulsion is the most common condition. Okay, so subinvulsion will be there, where there will be slow progress in the invulsion. Then obsessive vaginal discharge. Okay, the vaginal discharge will be present. Okay, so these are the signs and symptoms of what is that, perfural sepsis. Then management. The management include immediate management. Immediately you have to assess the condition of mother, that is check the airway, breathing and circulation, and maintain the IV infusion, and start with the IV administration with IV fluids, and blood antibiotic can be provided. Okay, in the form of IV, antibiotic should be administered, and antipyretics should be provided because of the high fever you can provide it, and painkiller also can be provided, because tender uterus will be there, tender abdominal will be there, so that should be provided. And uterine evacuation should be done if it is any kind of product is in the uterus or retained placenta, uterine evacuation should be done. And perineal care and hygiene should be provided, as well as nutritional support we have to provide to the mother. Okay, and monitor the vital signs, and maintain the input output chart. Okay, so these are the general management. And antibiotic include the injection of ampicillin, gentamicin. Okay, so that is the common drugs can be provided, and duration minimum 7 to 10 days it should be advised to take the mother for the medications. Okay, the nursing management include monitor the vital signs, that is especially temperature, because high elevation of body temperature is there, temperature should be monitored, pulse rate, what is that, respiration rate and blood pressure should be monitored, and assess the uterine tenderness and lochia. Okay, lochia should be examined. Okay, lochia should be checked. Observe the lochia, that is vaginal discharge, and observe the sign of complication. Okay, any other complication is present or not, that should be checked out, and maintain the cleanliness, and asepsis should be followed for the mother care, and give the medications on time. Okay, and encourage the mother to take high intake of fluid. Okay, then provide the perineal hygiene, change the pads regularly, and monitor intake output chart. Okay, so that is the things you can provide as a nursing management. And regarding health education, you can explain the importance of hygiene, because uh, it is a sepsis infection, so you can explain about the importance of hygiene, and encourage the mother about the balanced diet. Okay, and advise yearly reporting of any danger signs. Okay, advise the mother regarding the danger signs. Okay, so this is the uh, one of the nursing management. Okay, along with the nursing education or the health education. Okay, so perfural sepsis means what? After the delivery, especially when the woman is having the high temperature with the infections. Okay, so that is known as perfural sepsis. Okay, the next one is breast encroachment. Okay, next one is we are going to discuss about breast encroachment. So the name itself is there, breast encroachment. What is the meaning of encroachment? Encroachment is the swelling and fullness and discomfort of the breast. Okay, due to the increased milk production. Okay, so it is a most common postnatal problem for the mother, especially for the preemie mother. Okay, so breast encroachment is the one of the most common problem. So what are the causes of this breast encroachment? Sudden increase in milk production. Okay, sudden increase in milk production is the one of the causes. And next one is infrequent or delayed feeding. Okay, so the mother is not feeding to the baby or the newborn. Okay, or infrequent feeding. Okay, infrequent feeding, because normally newborn should be feeded every 2 hours or 3 hours once. So when it is infrequent feeding is happen, due to that the milk will be stored in the breast duct itself, so that may leads to the encroachment. Okay, so that may leads to the encroachment. The next one is poor attachment. Okay, or ineffective sucking. So poor attachment of latching. Okay, latching should be poor due to the like that may be the reason, or ineffective sucking. Okay, the baby is not able to suck properly the breast, so that may be the causes. The next one is long gap between the feeds. Okay, so as I told, 2 to 3 hours, every 2 to 3 hours the mother should feed the baby. When she is not feeding and 2 to 3 hours, that may leads to the condition. Okay, the next one is use of wearing the tight cloth. Okay, so that may be the reason. And next one is high salt diet. Okay, when the mother is taking the high level of salt, and that may be the reason for the breast encroachment. Okay, then signs and symptoms. So when you're talking about signs and symptoms, breast will feel full and heavy. The mother will complain that she have the uncomfortable. Okay, so heaviness in the breast. Okay, that is will be there, and swelling will be there, and tight and shiny skin. Okay, the skin of the breast will be tight and it will be shining, and warmness and redness will be there, and pain and tenderness will be there, and it's hard to pump the blood, hard to pump the breast milk. Okay, and difficult in latching the baby. Okay, so when mother is putting the baby on the breastfeed, the baby will feel difficult to latch the breast, occur the nipple, or restlessness. The mother will complain that restlessness, and low grade fever. Okay, sometimes the mother may have the fever due to the encroachment. Okay, so this is the signs and symptoms. And risk factor, when you're talking about a risk factor, preemie mothers are the most common people who develop with breast encroachment. The next one is excessive milk production. The women who have secretion more amount of milk, no, so that may leads to the breast encroachment. Then cesarean delivery people, okay, cesarean section may be the risk factor. And next one is stress and fatigue. Okay, stress and fatigue also may be the reason to develop the breast encroachment. And next one is inexperienced mother, that's what preemie para mother we will tell, so that may be the risk factor to get the what is that breast encroachment. The next one is diagnosis. Okay, how to diagnose the condition based on the history only. Okay, based on the history of and symptoms, the mother may complain that just heavy chest with the or the what is that heaviness on the chest or chest area, or the breast will be there, and based on symptoms, okay, tightness, as I told, no, tenderness and latching problems, baby is not feeding, and the milk is not coming out because of the hardness. Okay, all these things will be collected as a history and complained as a things. Okay, the next one is physical examination of the breast. Okay, so breast examination should be done, and rule of out of the mastitis or abscess, breast abscess or the mastitis. Okay, mastitis is the condition where the infection and inflammation occur in the breast. Breast abscess is the pus formation in the breast. That infection may leads to the pus formation. Okay, so all these conditions should be ruled out to find out the breast encroachment. Then management, when you're talking about management for this condition, frequent immediately relief means frequent breastfeeding is the one of the advice we have to provide, because when you are not feeding properly and delaying the feeding, it may lead to the breast encroachment. So frequent feeding should be provided. Correct latch, okay, correct position or latching should be done to the baby when the mother is putting the baby on the breastfeeding. Okay, and warm compression, warm compress before feed. Okay, so warm compress means you can apply the warmness, okay, so on the breast. Okay, so that can be not extreme cold or extreme cold, also heat also, warm application should be done, and cold compression after feed. Okay, so cold compression can be provided after the feed, and we advise the mother to wear loose supportive cloth, okay, for during the breastfeeding. That is the things. Okay, so that is the management we can take. And medical treatment, when we are talking about medical management, paracetamol can be administered as a to relieve the painkiller, because the mother is have the tenderness pain, so that can be provided. And antibiotic only if there is an infection. Okay, mastitis is there, then you can provide the antibiotic. Okay, then next one is adequate rest and fluid intake should be provided. So this all about the medical management. Prevention. So when you're talking about prevention, like short breastfeeding early. Okay, sorry. Uh, Start the breastfeeding early. So after immediately you can start the breastfeeding. You know, the normal breastfeeding can be initial feeding can be started immediately. If it is a vaginal delivery, within half an hour also we can start. Okay, so immediate breastfeeding should be advised to the mother to give the baby, and feed the baby frequently. Okay, so every 2 hours the mother can feed the baby to prevent the conditions, as well as ensure the proper latch on the breast. Okay, so baby is put correct position and latching should be done correctly. That should be make sure that, and avoid long gap between the feeds. Okay, so don't make the baby sleeping or baby is not demanding for the like feed like that. So avoid, don't make the gap between the first and second, or the feeding between the gap should be lesser, and wear proper supportive cloth, and balanced diet and adequate fluid should be taken. Avoid the stress and fatigue in the mother. Okay, then complication of breast, what's that? Complication of breast encroachment. What are the condition means? Mastitis, I told, infection and inflammation of the breast cells, and breast abscess. Okay, so pus formation will be there, and decreased milk supply. Okay, decreased milk supply to the baby, so that may be the complication, and cracked nipples will be there. Okay, so due to not feeding, the nipples will get cracked, and maternal discomfort will be complication. Okay, so these are the early complication will occur when the mother is developed with breast encroachment. Okay, understood? Breast encroachment. The next one is the next condition we are going to discuss about postpartum blues. Okay, postpartum blues and postpartum depression. So these are the condition which will come under the like psychological complication in the postnatal time. Okay, so what is psychological complication means? The mother usually will have the psychological complication because she have undergone the intrapartum period more like more stress. Okay, so more stress will be there. So that is the thing will be leads to the postpartum psychological disturbance in the mother. So when you're talking about psychological complication, first one is postpartum depression, postpartum blues, and also post psychosis. Postpartum psychosis is the last conditions. Okay, so what is first we'll discuss now postpartum blues. So what is postpartum blues means? A temporary emotional condition. Okay, it is a temporary emotional condition occurring in most mothers. Okay, occurring to the most mother after the delivery. Okay, so emotionally the mother is disturbed, so that is the postpartum blues. Definition: a postpartum blue is a temporary mood disturbance that affect the mother in the first few hours or few days after the childbirth. Okay, after the childbirth, within few hours or within few days it may be affected with the mother. It is a common or mild, or it may be the life threatening condition. Okay, so mostly it is a common will be there, but it may be a mild condition also. When it's not identified and not provided the emotional support or not timely identified, it may leads to the life threatening. Okay, then incidence. What is the incidence of postpartum blue means? It occurs 50 to 50 percentage to 80 percentage of the new mothers, means first time mothers. Okay, so 50 to 80 percentage of preemie mother. Okay, preemie mother, it may be developed, and being on day of 2 to 3 days after the delivery. Okay, immediately within the second day or third day it may occur to the mother. Okay, usually disappear within 7 to 10 days. Okay, usually it will be disappear 7 to 10 days. If it is not, that may leads to the postpartum psychosis. Okay, that may leads to the postpartum psychosis. So what is the causes of this postpartum blues? Maybe sudden hormonal changes. Okay, so mother is having the hormonal changes, especially decreased estrogen and progesterone. That may the one of the reason to get the postpartum psychological disturbance and postpartum blues. Okay, the next one is physiological fatigue. Okay, physiological fatigue and lack of sleep. Okay, the mother is not having proper sleep, it may lead to the conditions. And emotionally stressed. Okay, emotionally stressed of the motherhood, worrying about the motherhood, how I am going to take care of the baby, or the mother is emotionally disturbed, that may be the reason to develop the condition. And pain, fever and anxiety. Okay, pain, fever, fear and anxiety. Okay, pain, fear and anxiety will be the reason. Then like separation from the family and the support. Okay, the mother is not having the support from family, it may developed. Sometimes it may developed by the loss of baby also. Okay, so during the delivery, the mother is lost her baby, that may also reason for the developing the psychological problems. Okay, then risk factors. What are the risk factor means? First time mother who go deliver the first time, that may be the risk factor to develop the postpartum blues. And next one is history of previous condition of psychological disturbance or psychosis or the depression or whatever things. Okay, then mood swings. Okay, so mother is having the mood disorders previously, that may leads to the things. And next one is lack of support. Okay, the mother is not getting the support from the people or family members, that may leads to the things. Next one is unwanted pregnancy. The mother is developed with the unwanted pregnancy. Okay, the mother who don't want to continue her pregnancy, but now she delivered. So that kind of people also may be a risk to get the condition. The next one is financial and family stress. Okay, financial or family stress and lack of sleep or fatigue. Okay, so that is a risk factor of the condition. What are the signs and symptoms of postpartum blues? When you are discussing, mood swings will be there. Okay, the mother will have the mood swings and irritability. The mother will be have the irritability, anxiety, oversensitivity. Okay, the mother will react immediately for anything. Also, if you are going and advising or anything, if you are talking also, she will react overly. Then difficult in concentration. Okay, difficult in concentration on the baby as well as the personal care, and feeling of over what is that we will tell, overwhelmed. Okay, so like she don't like the, she want to be withdraw from the society. Okay, so with social withdraw thought also may be present, and crime and poor appetite. Okay, the mother may not have the appetite, and restlessness. Okay, so these are the some of the signs and symptoms of these conditions. Okay, and management. So when you're talking about management, reassure the condition and listen to the mother. Okay, so what she want, that should be needed, and encourage to the mother regarding the rest and sleep, and help the mother with the infant care and the household work. Okay, the next one is encourage to express the feelings. Okay, advise the mother to express the feeling and provide the emotional support. Next one is encourage the balanced diet and fluid intake more, and involving the family and the partner. Okay, that also you can encourage, and usually subsides its own. Okay, it's so usually it will disappear for the within, as I told, 7 to 10 days. If it is not, then you have to provide for the counseling. Okay, the nursing care include assess the mood and emotional state of the mother, and provide a calm and supportive environment, encourage the visualization of feelings, like open up. Okay, then promote the rest and teach the relaxation therapy or the techniques. Okay, you can advise the mother regarding the relaxation techniques, that is deep breathing and slight musical therapy can be provided, and educate the family about the conditions. Okay, so that is because emotional support is very, very important. So you can advise the mother about the or family about the support, and monitor for the sign for depression. Okay, whether the mother is going depression or not, that should be monitored. Okay, so this all about the nursing care about the postpartum blues. The next condition we are going to discuss about postpartum depression. Okay, postpartum depression. So what is postpartum depression? Again, it's one of the common in postnatal mother, especially again preemie mother, a mood disorder that occurs in the first 2-3 days or first week. Okay, within the week during the postpartum period. Okay, usually within 4 weeks it will be disappear. Okay, so that is the thing. So what is the definition of this condition? Perfural depression or postpartum depression is a non-psychotic disorders. Okay, non-psychotic disorder or depression that occurs after childbirth. Okay, that occurs after the childbirth, and usually being within the first 4 weeks. Okay, so usually it will be seen in within 4 weeks of postnatal time, but may occur anytime at the from the first year. Okay, in the 1 year of postnatal time it may occur anytime. So that is known as postpartum depression. Okay, again, causes and risk factor, hormonal changes is the one of the causes or the risk factor, that is in decreased estrogen and progesterone hormones, and physical exertions. Okay, so mother is physically exertion means because the mother, again the breast changes will be there, no, the mother have to feed the baby, all these things will be leads to the condition, and stress and anxiety. Okay, so the mother having stress and anxiety may leads to the postpartum depression, and previous history of depression. Okay, the mother during antenatal or during her adulthood, she developed with some kind of depression that may appear in the postnatal time. Okay, then lack of social support. Okay, again lack of family support or social support, and unplanned pregnancy. The mother is not planned for pregnancy and she is now become pregnant and got a baby also. So due to that there may be a risk for the condition. And complication during pregnancy or delivery. Okay, any complication is arised in during pregnancy or the delivery time, that may leads to the depressional conditions. Okay, then financial problems, poor relationship with the partner. So all these things the risk factor for are the causes for the postpartum depressions. Okay, postpartum depression. And signs and symptoms. What are the signs and symptoms means? Emotionally, when you're talking about mother, the mother will have sadness. Okay, so always the mother will have sad and crying and irritability. The mother will have the irritability, anxiety, feeling of guilt, and loss of interest with this baby as well as the personal care or whatever things, and worthlessness. Okay, so she will think that why I'm there like that and all. So that is the thing. And physically, when you're talking about, the mother will have weakness, fatigue, loss of appetite, and headache, body ache. Okay, back pain or body pain or sleep disturbance will be present. Okay, and then behaviorally, when you're talking about behaviorally, the signs and symptoms include social withdrawal. Okay, see, we don't want to mingle with anyone. Okay, she will be withdraw from family as well as the friends, and difficulty to give the care for the baby or the newborn. Okay, so you won't provide any care to the baby also. So that will be the signs and symptoms. And diagnosis. When you're talking about diagnosis, based on the history and the clinical assessment, we have to diagnose the mother that she is having the depression. Okay, so based on the symptoms, it will be there. Screening, what are the screening test can be done means, that is some postnatal depression scale. Okay, using the depressional scale we can identify the things and rule out the other medical and psychiatric conditions. Okay, all these things will become under the diagnosis. And management, when you're talking about management, non-pharmacological management include reassurance the condition and emotional, provide the emotional support to the mother, and counseling and psychotherapy provided. Okay, you should provide the counseling and psychotherapy can be provided. And cognitive behavioral therapy is one of the important non-pharmacological treatments, so you got to provide. And involving the family and the partner more in the care. Okay, so making the family members, making the husband to talk to the mother and providing care, that is very important. And the next one is encouraging the breastfeeding. Okay, so make the mother to motivate the mother to provide the breastfeed to the newborn. And stress management techniques. Okay, so that is relaxation, meditation, yoga and all can be advised to the mother. So when you're talking about pharmacological management, that is antidepressant drugs. Okay, antidepressant drugs can be administered as per the doctor order or physician order. Okay, treat only with the mother is not having under the medical supervision. Okay, so that is very important. Okay, then nursing management include build the rapport between the patient and the nurse, as well as make the trust. Okay, so when you are making trust rapid, or that may make the mother to tell about her problems openly, so that trust building should be happen to the nurse between the patient. And listen to the mother patiently. Okay, so first listen to the mother about her complaints and provide emotional support, encourage the expression of feelings, allow the mother to express her feelings, and involve the family members in the care. Okay, then ensure the adequate rest and sleep. Okay, so you can make sure that the mother should have the proper rest and sleep, and promote the nutrition and hydrogen, and help in baby care. Okay, we have to provide the help in provide the newborn care, and observe the observe the mother for any kind of suicidal thought is there or not. Okay, then observe and continue monitoring is very important, and if it is there, refer the psychiatrist if it is needed. If the mother is needed for the counseling, you can refer the mother to the psychiatrist. Okay. So this all about the things, and when you're talking about the complication, poor mother infant bond will be there, neglect of baby will be there. Okay, family relationship problem will be developed, chronic depression. When you are living this condition, the mother may leads to the depressive conditions. Okay, and suicidal thought and attempts also may be performed to the mother. Okay, so I hope you understood these 5 topics, correct? So that is the PPH, perfural sepsis, and breast encroachment, postpartum blues, and postpartum depressions. Okay, so this is the most common topics when we are talking about the postnatal complication. So what is the difference between this postnatal depression and postnatal blues? When you are talking, it starts, postpartum blues will start within 2 to 3 days after the delivery, and it may start any time within 1 year also. Okay, the depression may start with any time after the things within 4 weeks, after the 4 weeks, or it may be within 1 year also the depression may be developed. And postpartum blue have the mild symptoms, whereas the postpartum depression will have the severe symptoms. Okay, then it may be disappear within 7 to 10 days, but it will be present in long duration. Okay, depression will be present in the long duration. This postpartum blues does not involve interfere any normal life, day-to-day life. Okay, but this depression will be involving, or it will be suppress the normal day-to-day life. Okay, so that is the thing, and here no need for drugs, but here antipsychotic drugs is administration is very important. Okay, so that is the differentiate between the postpartum blues and postpartum depression. Okay, thank you.